Okay, so I'm going to take you through a different way to answer these multiple choice questions. So we're going to kind of reverse engineer these multiple choice questions. So I'm going to provide you with the answers first, and then you are going to select the um, appropriate interventions for each possible answer. Um, Let me just correct this, and then we'll look at the case study second. Okay, so instead of looking at the case study like we did before, and we kind of underlined all the pertinent information and then looked at the questions, let's do it in the reverse. So if you were given this question, which stretch would be appropriate for this client? Sorry, this is wrong. This was the option that I wanted. Okay. Which stretch would be appropriate for this client? So you have gentle lateral flexion, stretch for the suboccipitals, end range extension, and strengthening flexors. So what you can do here is, instead of looking at the case study, for each of these possible options, indicate the things that would tell you that you needed to do lateral flexion of the neck or stretching for the suboccipitals. So now if we do that, if we look at this, gentle lateral flexion of the neck for 30 seconds, why might you do that? You might do that because you have tight lateral flexors. So that's an indication for stretching those muscles. And so if you have tight lateral flexors, those include the traps, levator scap, there's a few other there. But now you have some type of indication you might look for in a case study. Why might you stretch the suboccipitals? So you might stretch the suboccipitals because somebody gets headaches, often associated with headaches. You might strengthen or stretch the suboccipitals because you have anterior head carriage. That also causes tight suboccipitals. You might stretch the suboccipitals because they have weak flexor weakness. So they might have weakness in flexion or decreased active flexion. For end range neck extension, why would you stretch the neck extensor? So if you brought the neck into full extension, why would you do that? And well, you would do that because the extensors are tight, right? Or because you have limited extension. Strengthening flexors. So now if we look at this option, we negate it even before we look at the case study, because the question is asking you for a stretch. So if the option says strengthen, it's out. It doesn't matter. It's never going to be the answer if the question is asking you for a stretch that would be appropriate. Okay, so we have a few options here. Let's highlight these. And so after you've created some of these options for the possible answers, when we look at the case study, we're going to look at these things and see if they appear in the case study to help us answer this question. So let's just do the next question. Based on the information provided, which we don't know what it is, which type of exercise would be inappropriate? So you're not looking for something that's not effective. Not effective is different than inappropriate. Inappropriate is like saying contraindicated. So you're looking for which of these is contraindicated. So here are your answers. Your answers are isometric, concentric, or stretching. So it's not telling you what muscle is being targeted. It's just telling you the types of stretch or strengthen. And so this question, you can probably guess, is asking you to look for what stage of healing the person is in. So if we just list out what stage of healing are isometrics inappropriate for, none. So every stage of healing, you can do isometrics. What stage of healing is concentric strengthening inappropriate for? Well, that's acute, right? So acute is the only stage of healing where we wouldn't do a concentric. We do it in subacute and we do it in chronic. What stage of healing is stretching not appropriate for? Again, that's acute. So acute is a stage of healing where we wouldn't do any stretching. So that would be inappropriate. So now when we go back and we look at our case study, we're going to look for whether or not this person is in the acute stage of healing. We already know that isometrics can't be the correct answer because there are no contraindications to isometrics, right? So we can actually get rid of that right now. We just have to choose now between concentric strengthening and stretching. So now we have a few options here, right? If we're thinking this through. And in fact, we don't even need to look at the case study for this. So concentric strengthening and stretching are both inappropriate for acute. If this person is in the acute stage of healing, we would have to be able to select both of these. So we don't even need to look at the case study right now because we already know that if this person is in acute, that's the only situation where we would be able to pick B or C, and we can't pick both of them. So this person cannot possibly be in the acute stage of healing. So we already know the answer to this question is D, just by process of elimination. So let's see if we're correct. So this is the case study. I'm just going to copy and paste it next to the questions so that we can take a look at them. So here is the case study. So let's just look at this first question. 21-year-old student with chronic neck discomfort and tension headaches. So you'd had this on a previous test before. So now what we're looking for in this case study is whether or not anything indicates that she has tight lateral flexors of the neck, headaches, anterior head carriage, flexor weakness, decreased active flexion, or extensor tightness. So let's look at for those key words. So when we scroll through this, we see, oh, she has tension headaches. Let's highlight that. Neck feels tight and sore, especially after sitting. She uses a laptop. In assessment, you notice, oh, she has anterior head carriage. Here we go. She has increased cervical lordosis. What does that mean? That means she has extensor tightness. Oh, this is wrong, sorry. You would do end range extension for flexor tightness. Sorry. Do you see the error I made here? So this one asks you to do neck extension as your stretch. That means the flexors are tight. Sorry about that. Okay, you probably caught that already though. So she has increased cervical lordosis, which means that the extensors are tight, right? So there's nothing here that indicated that we selected that said extensors tight, but that's okay. Her active range of motion, neck flexion is not painful, but she has weakness in neck flexion. So here's another one that we hit. We indicated that the reason you'd stretch the suboccipitals is for flexor weakness. And flexors may be weak because the extensors are too tight. So we can get rid of this because we know that her flexors are not tight based on this case study. So we can get rid of this. So now we have to choose between A and B. These lateral flexors, like trap and levator scap, are also extensors. However, her postural deviation, anterior head carriage, increased cervical lordosis, is an anterior-posterior deviation, not a lateral deviation. In addition to that, she gets headaches. She has decreased flexor strength. And so this B is the most appropriate answer because it addresses the direction of her postural shift. So we get rid of A, and the answer is B. Let's do that for the same way for this second question. Okay, so now we're looking at the second question. Actually, we don't have to answer the second question because we already answered it. We didn't have to even look at it. So this second question was asking you which exercise was inappropriate, isometric, concentric, or stretching. And we already eliminated all of that. So now if we look at the case study, we can confirm that because her case study says that she's had this for 2 years and even uses the term chronic. So what was here was isometric, concentric, or stretch. None of those are inappropriate for the chronic stage of healing. And that's why we were able, we can confirm that we can get rid of those. The answer is none of the above, but we actually didn't even have to look at the case study to answer that. Cool, okay. So I'm going to give you 2 questions to do on your own. This is the one that we just did. Okay, so I'm going to scroll down here. Here are 2 questions. Okay. Your best stretching exercise for this client would be, and which of the following recommendations would best help your client minimize her scoliotic curve? So these are both based on the same case study. So what I want you to do is I want you to go through these the same way that I just went through these. Best stretching exercise. So if you rotated your trunk to the left, what would that stretch? And list all the muscles that would stretch. If you laterally flexed the spine to the left, what would that stretch? List it all out. Do the same thing for number 2. Which of the following would best help your client minimize her scoliotic curve? So, avoiding too much stretching of the muscles on the left side of the spine. What type of scoliosis, or where would the curve be where you wouldn't want to stretch the muscles on the left side of the spine? What would be the orientation of the scoliotic curve? Where would the convex and concave be if you wanted to avoid too much stretching? So I want you to go through those the same way. So pause this now and think about those. Add those little bits of information that provide you an indication to look for in the case study. Pause it now because in a second I am going to scroll down to the case study. Okay, I'm going to scroll down now so that you can see the case study. So I'm assuming that you have gone through this yourself and haven't cheated. I don't want you to look at the case study first. I want you to answer, provide some indications for those answers. So here's the case study. And see if you can select the correct answers based on this case study. So this is from one of your quizzes. Client is a 12-year-old gymnast with a left thoracic scoliosis, convex on the left. She says she feels better when she moves and wants a way to help more effectively work out to target the specific changes in her spine. So based on that case study, go back to your questions and see if you can come up with the best answer based on the information in those case studies. So I'm going to let you again pause this, and I want you to answer those questions. And when you unpause it, I will come back with the correct answers. Okay, so if you have unpaused, it's because you've answered these questions correctly, hopefully. Okay, so let's look at this. Your client is a 12-year-old gymnast with a left thoracic scoliosis curve. So she has a convex on the left. So when there's convex on the left, that tells me that the left erector spinae, let's say, are stretched out, and the right erector spinae, or longitudinal muscles, are tight, yeah, for lack of a better term. If she has a convex curve on the left, we know that the concave curve is produced when the spinous processes rotate towards the concave side of the curve. So if she's convex on the left, she's concave on the right. That means her spinous processes are turning to the right or pointing to the right. That means if your spinous processes are turning to the right, your trunk is turning left. Yeah? Okay. So now we can answer these questions, or that'll help you answer these questions. Your best stretching exercise for this client would be trunk rotation to the left. Can't be, because that's what she's trapped in already. If she has a convex curve on the left and a concave on the right, her trunk is already turning to the left. Can't be this one. Lateral flexion of the spine to the left. So again, we come back up to our rules. If you laterally flex the spine to the left, it means you're stretching out the right erector spinae. Does that fit? Absolutely, because on the concave side, the erector spinae are tight, so that's a possibility. Lateral flexion of the spine to the right would stretch out the left side erector spinae. That can't be it. And so we already have a correct answer. It's got to be B. Can't be none of the above, because we already identified B is a correct method of stretching. Okay, so now let's look at this second one. I just want to post the question right on top, or the case study. Okay, so now if we look at the second one, which of the following recommendations would best help your client minimize her scoliotic curve? Okay, again, same rules as above, right? So let's copy these and put those little notes here to help us answer the question. Okay, which of the following would help your client minimize her scoliotic curve? Avoid too much stretching of the muscles on the left side of the spine. Well, the left side are stretched out, so that's a possibility. This could be a possibility. Avoid strengthening the muscles on the left side of the spine. No, you don't want to avoid strengthening. Those left-sided ones are stretched out. So you don't want to avoid strengthening. So this has got to be out. This is not going to best help your client, right? The case study is asking which would best help your client. And not strengthening the muscles that are stretched out would not best help your client. That would be contraindicated. Do more stretching to the muscles on the right side of the spine and more strengthening to the left. Okay, so do we have to stretch the muscles on the right? Absolutely, because the right side are tight. That's the concave. Do we have to strengthen the left? Absolutely, because they're stretched out. This is absolutely a possibility. Do we want to stretch the muscles on the left side of the spine? Nope, they're already stretched out. So I don't even need to read the rest of this answer. This is gone. So now I have to select which one is the most correct. So I'm looking for which of the following would best help your client minimize the scoliotic curve. And the answer has to be C, because you're doing two things. You're correcting the short muscles and correcting the long muscles. This A is only correcting the tight muscles, not the weak ones. So it is not the best. It's correct, you can still do it, but it is not the best option. So your answer for this is C. Take a look at some of the other case studies, the case studies from other quizzes, other classes even, and see if you can apply those same principles and if that better helps you answer multiple choice questions.